Nice. So, nice. Okay. Welcome. Welcome to Medical Mondays with Dr. O. Welcome to another amazing evening. This evening, we have a topic that I'm sure most men may not log into, but they should. So, for the men who are on this platform already, thank you. And congratulations for being forward moving, forward going, forward seeing. I'm Dr. Toyin Okpesomi, a family practitioner, HIV specialist who treats substance use disorder also in Maryland. And I am excited to be here to introduce to you my daughter, Dr. Ebere Azumah, who, oh my gosh, where should I start with her? I would want her to introduce herself, but I have to say this. This is a physician who is one of the most humble human beings I've ever met, who is amazingly intelligent, but she would never throw herself out there at anyone. I don't think she's ever introduced herself as doctor or whatever. But you just need to interact with her for a few minutes and you will know that you have a gem on your hands. She has a heart for people, for the populace. She is, you know how they say small and mighty? She is the president of ANPA, that is the Association of Nigerian Physicians in the Americas, where I am also a member. She also is the president of Love Your Menses. And I pray that she will say a lot more about that during the conversation tonight, because that is a program that supports our young folks. They look towards meeting the needs of our young folks in places you wouldn't even imagine. So without much ado, Dr. Azumah, I would love for you to please properly introduce yourself. And the floor is yours. Welcome, everyone.
Thank you so much. Welcome, everyone. Dr. O, you're amazing. I love Dr. O. Dr. O is just, she describes me as humble, but I think she's more humble than me. I emulate her. I love her, and she's just a blessing. She's just a blessing. I'm just praying that God will continue to bless her financially as she blesses others, because she is. I'm so blessed to have a role model, someone to model my life after. So I'm very grateful. Welcome, everyone. Thank you for those that logged in from Nigeria. I've attended Medical Mondays. I've learned so much. And I really applaud all those that are from Nigeria and around the world that log in to listen to Dr. O and her team or her speakers teach us from their hearts. Today, I'm going to be talking about something very important. I will introduce myself shortly as well. And to add to what Dr. O has said, we're going to be talking about menstrual equity for Medical Mondays. Myself, just briefly, I'm a OBGYN. I love to learn. I have a very growth mindset. So you see, I do a lot. Like, I'm a trained doula. I love the fact that I can teach my patients how to have alternative to pain management or just managing pregnancy. I have a public health degree. I educate the community. I like to create organizations. I'm the founder and leader of Love Your Menses. I'm also the chair of the AMPA of the DC, Maryland, Virginia chapter. So I'm here speaking as the co-founder and president of Love Your Menses. So we're going to be talking about 5 objectives. We're going to be talking about Love Your Menses. We're going to be talking about meets taboo about period. We're going to be talking about global period poverty. We're going to talk about menstrual equity. And then we're going to end with Love Your Menses and our call to action. This topic is not going to be sequential, so bear with me. Don't be looking for like menstrual equity came before debunking myths. It's just 5 things to pay attention. So let's talk about Love Your Menses. Now everyone is talking about menstrual equity. Those of us in the Washington, D.C. area, Maryland area, we see that there's a mandate in the D.C. public schools that they will be teaching menstruation to kids, because we realize that menstrual inequity and menstrual equity is very important to teach. We are excited, and I'm very, very excited, because in 2019, when we started talking about this, it was not common, it was not there. So the Lord laid this upon our hearts, and we are now like one of the godfathers in menstrual equity. So it's really, really cool that a topic as important yet as simple in terms of me being a gynecologist can be making a huge difference. So like I said earlier, we were founded in 2019 in Boston. At that time, I took time off to go learn about public health, health management, and community education. I happened to have landed in Harvard for that. And during my time there, I teamed up with someone else to found Love Your Menses. And to God's glory, we started in Boston, but we're now in eight countries, including the United States. And to be transparent, if we have the financial capacity, we would be in more countries, because we get calls, people wanting to work with us. So we are in the United States. Our headquarters is in Boston. We love Boston. Boston loves us. The mayor who is in love with us, thank God, and wants to work with us most times. So we're very grateful. We're in Hartford, we're in Detroit, we're in DC, Maryland, and Virginia. We're also in Wisconsin. We're in Haiti, in Port-au-Prince, and we are also in Liberia and Monrovia. We're in Uganda. That's our newest country, in Kampala. We're also in Gambia. We're also in Nigeria. We're also in Kenya. We're also in Sao Tome and Principe. So it's really cool that this message is heard globally, and there's room for expansion. Again, I'm still a clinician, so it takes a lot of work to lead the organization. It's really, it's busy work, and I don't want to give my clinical practice. So I'm trying to manage as much as I can with my amazing team, which you will meet soon. I'm the co-founder and the president, and we have our interim executive director, Israel Walker. She's a pre-med student. She went to Wesley for her undergrad. She learned French and biochemistry. You're going to see that our team is made up of very intelligent people. Again, those listening from Nigeria, it's not a big deal. You always see Black leadership, but in the United States, it's a big deal, because people rarely see a very organized nonprofit led by Black people. So a lot of times when we go to look for grants, we're discussing with people of another race, and they always want to see, did a white person help us start it? So we remind them that, we can start too, things if given opportunity. So the board, again, vast majority, mostly women, very intelligent. For example, Dr. F. Young is a board certified pediatrician. She's also a public health professional. We have Dr. Kudwa, who is also an internal medicine resident at Howard. We have Abraham, who is a treasurer and an accountant. We have Nancy Bianco, who is a board member, but she's a registered nurse and has been a nurse for over 20 years. We have Deborah Okundo, that is, she has a degree in accounting, but she acts as a caregiver. So we have different people, but with one passion, which is to provide menstrual equity to everyone, and to just, empower our youth. Again, our team is large. So we have Mioria, who is our program manager at Sao Tome. We work with people on the ground, meaning that we don't impose our ideas in those various countries. What we do is we work with them. We bring the education. We don't give them money as much as people think we should, but we give them knowledge, knowledge that they are happy, knowledge that has advanced some of them. You're going to meet James. When James started with us, he was a small organization. Now he's a leader in Kenya, working with the government, because he worked with us. We showed him strategy in terms of creating menstrual equity and creating their messages. So it's really cool that organizations that start with us grow big if they are really determined. We have Yasa, who is has a nursing degree, a bachelor's of science in nursing. She's so brilliant. She's also working on her master's in social work at Temple. She's our global menstrual equity manager. We have Dia. Dia came to us as an intern. She helped us start our science part, our STEM part of Love Your Menses. And she has now gone to medical school, and she's in her second year of medical school. So it's really cool to see us mentor people even within our organization as we mentor people externally. We have Matita too. She also started as a pre-med student. Now she's a third-year student, going into her third year at the University of Wisconsin. Very brilliant. She's our program manager from Gambia. We have Dr. Anne Antoine. She's our program manager in Haiti. She's a physician already. We have Ifoma Adam. She's a program manager, executive program manager in Nigeria. She's based in Abuja, so she helps us out there in Nigeria. She's also our global menstrual equity coordinator. She's the one that manages our international arm. And then we have Jackson Fula, who is our program coordinator at Boston. We have Elisa Otto, who is our FlowTech program manager and our research manager. We have Dael, who is our communications fellow and coordinator. I just like to introduce our team because they are very pivotal, and because these people, we don't pay them enough, but they do it because of passion. So my contribution or thank you to them is to showcase them when I speak. We have Miss Martin, who is our Nigeria program manager. She's based in Lagos. We have James, who is our Kenyan program manager, and we have Fabian, who is our Boston program manager. We have Amina Baxter, who is our program manager in the DMV area. We have Atali, who is our maternal health program coordinator. We have Dancer, who deals with health equity and community ambassador. And we even have the youth, Leah Silvera. Leah Silvera started with us as one of our students. And if during that time period, she was named Miss Massachusetts, the youth version. So we see our students doing really well. We have newer members. Thanks to Dr. O, we have Oluwa Fonshu, who is a part of us. I met her through Dr. O. She's brilliant, hardworking, and she's also aiming to become an OBGYN. We have Elette DeVille, who is a youth ambassador, and she was Black Miss Massachusetts in, I believe, 2022. And then we have Dr. Fonose, who is our research advisor. She has won multiple awards in research. We have Dr. Chukudum also. He helps us out. He's our advisor. I can't remember her name. I remember it. And then our newest team member is Mr. Victor, who is from Uganda. All right, so we're going to talk about menstrual health and equity. It is important to realize that 1.8 billion people across the world menstruate. We talk about HIV, we talk about cancer, but I don't believe 1.8 billion people have cancer, which we don't want to happen. But 1.8 billion people menstruate. So this is an important topic. Luckily, menstrual inequity is increasingly recognized as an issue domestically and globally. We saw during the COVID pandemic that menstrual cycle did not stop. Everything ceased, but menstrual cycle did not. It is here to stay. So why do we discuss period poverty? Period poverty is when a young girl cannot afford menstrual products. And we see during the COVID period that there was job insecurity, homelessness, and food insecurity was at a rise, and some people could not afford menstrual products. Hence, now we have a growing menstrual equity movement in the country. Like I said, DC is going to start teaching about menstrual education. So menstrual equity includes product distribution and menstrual education. Our goal as Love Your Menses, our abbreviation is LYM. We hope to empower a generation of unapologetic menstruators. So what is our solution? Our solution is to continue to bring excellent evidence-based menstrual health education. We connect people to resources and we have community conversation as we are doing right now under Medical Monday. More on menstrual equity. So menstrual equity includes menstrual education. Menstrual education includes us discussing something called period trauma. We also will talk about debunking myths and taboos associated with periods. We'll talk about global period poverty. We'll talk about menstrual equity and a call to action by Love Your Menses. Okay, so there's a doctor that is a big champion, Dr. Cherish Chamber. She defines period trauma as any sustained psychological, social, or emotional injury associated with menstruation. Period trauma, some people don't talk about it. I remember speaking to a dear friend who is a midwife. She confessed to me that she had an elective, quote unquote, hysterectomy because she hated her period. Like her period was a time of not being unapologetic, but a time of shame. A lot of people, their period is not always associated with fun, right? Some of them is associated with pain. Some people cannot go to work because of the pain that they are having. Some people cannot even take care of their family because of the pain they are having. But these people, even in spite of their pain, some of them are shamed. I work with, I said, 7 other countries, so I listen to these women talk. In Uganda, you're seen as weak if you talk about painful periods. Some people feel ashamed taking Motrin during their periods because they feel like it should be normal, that they are going against physiology by taking pain medication. For most of us here, we are like, this is ridiculous, but it is truth. And that's why we're here to dispel taboos associated with period. 6 out of 10 women and 9 out of 10 women of African descent are expected to develop fibroids. People also have endometriosis, so any pathology associated with menstruation can lead to period trauma. The lack of access to period products has led to 1 or 2 years of missed school days per month, which is 9 to 18 days. And you know how competitive our world is. Missing school is not an option for some people. At least those people would not get an award for perfect attendance. So we're going to debunk some myths and taboos associated with periods. We will start with, what is a taboo? Taboo are anything that's socially unaccepted in a community and is unique to the community. Like in some cultures in Nigeria, you don't look into people's eyes, especially your elders, when you talk. But in the United States, and those of us that have been here for long, you know when someone is talking, when you're talking to someone and they don't look at you, you begin to wonder like, is this person a liar? What's going on? We think that there's a problem. I had to take a step back to remember that that's true, right? When I was younger, we couldn't look in the face of adults. But here now, when you don't look at us, we're like, are you okay? Are you listening to us? So those are like socially unacceptable language. Stigma, it's not that it's forbidden, but it is something that can cause shame. For example, in Uganda, some girls, I guess it depends on the personality of the girls. They don't go to school because they are teased during their period. Let's say they have a little stain on their dress. Someone would make fun of them. So they stigmatize you for your menses. So our goal is to end stigma associated with menstruation. For example, severe period pain is not normal. So we want to debunk that stereotype that you're strong if you can handle period pain yourself, especially without medication. So what are myths and what are facts? There are some people, we deal with a lot of adolescents, so this might be adolescent language, but we also teach adults, because the way to change culture begins with both the adults and also the kids, because the adults teach culture to the kids. For example, myth or fact, period blood is dirty, sinful, or impure. We know, in fact, menstrual blood is like any blood elsewhere, so it's not dirty. When you have premenstrual syndrome, it makes you angry, unstable, and crazy. Is that myth or fact? We know premenstrual syndrome does not make you crazy. It's just a fluctuation or influx of hormones that can affect how you act, but it doesn't make you crazy. Love Your Menses, our global goal is to end period poverty. It's really cool. I love our organization because if there was a perfect timing to start, we never had that time. We just had the passion, we just had the skill set, we just had the knowledge, and we just started it. And it's really cool because some people have studied how we started it, because most people would want, capital to start this, but we just came together and said, let's implement what we know, identify a problem and find a solution, and share the gospel of Love Your Menses. So what is period poverty? Like I alluded earlier, period poverty is the inability to afford period products. We see that 16.9 people who menstruate in the United States are living in poverty. Sometimes, for some people, they're like, oh, it's cheap, it's just $5. But if you're a student in college, I don't know if you guys remember it, but if you have to decide between buying food and getting your period products, no one should be put in that position, especially if we can afford it as a community. Two-thirds of 16.9 million people in the United States cannot afford the products. So we would eliminate period poverty if we make period products available in public restrooms, in schools, in hotels as well. A lot of men don't realize this. Let's say you travel and you forget to pack your pads. It could cause a stumble when you travel, because there might not be period products in the hotel or period products in the restroom. No one wants to walk around with stained clothes, because we're still stigmatized if we do so. So like I stated earlier, 1.8 billion across the world menstruate. So period poverty, menstrual equity is an important issue, and it should be an important issue for everyone, especially those that have daughters, auntie, and sisters and nieces. 500 million people, especially in sub-Saharan Africa, lack access to menstrual products and hygiene facilities. The lack of menstrual products for school students is a major barrier to education, especially in sub-Saharan Africa, where the kids don't go to school and don't have ways to make up for their lost time. Menstruation, as I said, has been linked to increase in school absentees during that time of the month. Many resort to unsanitary methods to manage their period. And unfortunately, as in Kenya, we see some girls exchange sex for pads. It's pretty sad. In the United States, I don't know if you noticed, 22 states still tax women for period products. We think people should not pay taxes on period products, especially if it's not free. So Love Your Menses has joined in eliminating period products in the this last quarter or semi-annual. We've given over 30,000 pads locally, nationally, and internationally. We've been named Always Period Champion, and they've made us one of their distributing centers. So we have a storage system whereby we have a lot of pads and we donate to those that are in need. We'll be working with the Boston Mayor's Office to provide menstrual products and education for the youth in Boston. We hope to work with the DC public schools to provide menstrual education to them as well. Because of we're leaders and we've been in this field for so long, we decided to launch our own menstrual education and awareness certification. It's a 4-lesson plan, and we've piloted 8 in Uganda. So we go over different curriculums, and it's just really cool. It's so cool to implement everything that we see. Again, I love the fact that we're a nonprofit, but we're scholarly and we're academic. It's like so cool. It's so different, you know. Every time I go somewhere, people are like, what university are you affiliated with? I said, Love Your Menses University, because there's not. So the programs we offer, I mean, it's just beautiful. It's really cool. Really, really cool, guys. Because, you know, when you're creative, people always tell you, oh, you have to be academic to do this. You have to have godfathers, grandfathers to do this. But the truth is, if you have God and you have creativity, you can do anything. And I think our organization is one that proves that you can do anything with, you know, the right mindset and creativity. So we have period parties. We're going to be doing one in Connecticut where we have a group of girls. We just celebrate them. Again, this program is mostly for Black and brown girls. So it's really intentional because we want to educate and empower our youth. And we felt the way to do that is through their menstruation. Bring them together, talk about menses, and then talk, and also model behaviors. So we make sure that when we go to communities, we have their doctors, their nurses, and all different professions, females come out to teach them. So because we want them to know that they're not alone. Sometimes they're like, wow, if you could do it as a doctor, I can. And we say, yes, you can. So we have a lot of secondary gains in our program. Apart from menstrual equity, we really empower our Black youth so that they can do better and believe themselves by watching us, by emulating us. We also have our app called our Flow app. It was designed and created by our Boston youths. We also do consultation and training programs. We also train men for menstrual equity because men are joining this movement because they realize like, wow, I didn't know this was a problem. Maybe if I can be more compassionate to my daughter, she will act better. If I can, this is a good way to start a conversation with my family. And no, every woman loves a man that can say, are you okay? Can I go get your pads? Can I buy you some over-the-counter pain medication for your menses? It's kind of a good way to build relationship between families. We also do a menstrual and mental wellness retreat whereby we get our youths and just have them talk about things that hurts them. So we also teach them about safety. We teach them about saying no. So we just basically use this program to just do a lot for our community. We have something called Sister Docs, which is a monthly webinar whereby we just talk about different things. We talk about alopecia, almost like Medical Mondays, but more female focused. We also have a soul program whereby we teach people how to create reusable and sustainable products because some countries that we work with, specifically Sao Tome, they don't like to use some disposable menstrual products because they don't have the facility to break it down. They're very conscientious of their environment, so they prefer to use reusable, such as cloth pads or cups. We also have an annual empowerment event. We have programs that we teach in schools. We do teach at schools. We've done Mother Caroline in Boston. We do Cambridge School also in Boston. We go in and teach the kids. It's called Understanding and Embracing My Flow. Basically, they understand their flow, they embrace it, and they're elevated. We have our STEM program, which is Flow Tech for Girls. We just completed a 16 weeks program. This time we made it international. Thanks to Zoom, we can do that. So this time we made our Ugandan kids from Uganda, to meet the kids from Kenya, to meet the kids from Maryland, to meet the kids from Boston, to meet the kids from Texas. And these are all Black kids. We also have them meet the kids from Nigeria, in Abuja. So the goal is for them to create a pen pal system so that they can know that they're not alone, and they can also widen their horizon. For example, I remember one time they were having a conversation between the youth from Maryland and the youth from Liberia. We asked them, the Liberian youth, what is your biggest concern? They talked about rape. They can't go home, they can't walk home by themselves after a certain time because they'll be victim of rape. Our 11-year-old girls in Maryland is like, oops, we're talking about bullying. So it's really cool to see them exchange ideas and just the culture, because we believe that if our African-American youth here know their counterparts in Africa, there could be exchange of culture, exchange of influence, and the overall goal is to improve the world and to better themselves. We also do the product distribution. We also have a postpartum education and support group whereby postpartum moms can talk about what they're experiencing at home as a new parent. So what's our call to action? Our call to action is for us to continue to advocate for free and affordable products. Products should be more accessible, and products should be safe. We didn't go into the safety mechanism or the products that are safe for menstruation, because there are some that have endotoxin that could be harmful in the long run for women. Girls, women, and all menstruators should have the choices for the products they want to use. We hope to help end period stigmas surrounding menstruation. We hope to help decision makers, healthcare providers, educators, and individuals make menstrual health a priority. So actionable steps include change the way you talk about periods. There should be no shame in talking about periods. I remember I saw a young girl. She was complaining of vaginal itching. I'm a gynecologist, and she was like, the girl down there is itching. I was like, where's the girl? She was not comfortable even naming her personal private parts. And we see that girls that know and are comfortable naming their private parts are less likely to be abused. It's just what the data says. We want you all, okay, Tino, at a day, 1 minute.
Continue. You can complete
Okay.
Please complete your presentation.
Okay.
Thank you.
We want you to help spread the LYM message. We also want you to respect that not everyone will become comfortable talking about their periods. I remember one of my colleagues who is an internist, she said, you know what, Ebere, it's true, love your menses, that I had to take a step and say, what does love your menses mean to me? Like, what does loving her menses mean to her? And she realized that she didn't love her menses, and she used it as a conversation starter with her 2 daughters. And she's like, you know what, thank you. It's because of your messaging I was able to reflect and realize I did not love my menses, but we had a conversation with my daughter. So our goal is for everyone to love your menses. Yes, it might not be perfect. Yes, you might have pain. Yes, you might not be able to afford it, but we hope that you will have a positive mindset while you're on your period. We also have to know that everyone is different and the experiences can also be different, but we want you to support them. The first step is to ask them if they want your support, and to ask how do they want your support. We have our mobile app right now. Is the Apple app is down, but we're trying to fix it. But if you have Android, please go and download it. You can see us here, and we are hoping to take our African-American youths to Kenya. We're still fundraising for it. We thought we were going to do it this summer, but it wasn't, we had to postpone it. But we are hoping that hopefully next year, we'll be able to take our African-American youths to finally meet the youths that they worked with for 16 weeks in Kenya. Thank you so much. That's the end. I can't believe I could talk about menses for almost 45 minutes.
It's an important subject.
Yes, ma'am. Let me stop this share.
Thank you so much. That was amazing. Totally amazing. I remember my menses, 7 days every month. I was regular, but it was 7 days, heavy, thick clots. I didn't know what the clots were. Nobody educated me. When I started menstruating, I remember I was in boarding school. So it was my boarding school friends
Mhm.
who gave me sanitary towel and said, just use this. Nobody educated me. I got home and told my mom what happened. My mom said, come sit down. She said, congratulations. You've now become a woman.
Wow.
If you have sex, you will get pregnant. And
Oh,
you are
no.
dead. That was my menstrual talk.
Yes, ma'am. Wow. That's not
So
enough.
you bet I ran away from all men.
Oh my goodness.
But nobody talked about the heavy menses, the myths and stuff like that. So thank you so much. What you're doing is so important. It's amazing. My mom is an amazing woman, strong woman. And what she said that day impacted me so much, made me today. I get it.
Yes, ma'am.
I get it. But we need education. We need stuff like this. I'm going to call on you. Usually I call on people who raise their hands, but today I want my feelings to be here first, if you don't mind. I never thought about, having feminine products in schools, in restaurants, at hotels and stuff like that. But I remembered recently when She Rises, and I have to talk about She Rises.
Okay, no.
Decided to do a drive, and I'll talk about that in a minute. One of our doctors texted me and said, oh, wow, this is fantastic, because she went on vacation with her husband and menses came unexpected, and there was no sanitary towel.
Yes.
She couldn't get sanitary. She said she had to revert back to the old style toilet paper. And I was like, it is really important to collect these sanitary towels. So what you guys are doing is phenomenal. And this last Saturday, I still have some questions. I'll leave that for later. This last Saturday, She Rises in Maryland, led by Attorney Tinu Akinshola. She started it. They collected, did a feminine products drive in front of Giant at Buttonsville. And I was there. I was there with my feminine products, and we were doing the drive. It was fantastic. It was fun. Both men and women came by and contributed. This is phenomenal. Please, every listener today, what Dr. Azumah is doing here is more than what she presented, because there's a major component of what they do, and it is in bridging that cultural disparity, bringing girls together. I have seen it. I was very heartbroken that they could not take the girls from here to Kenya this year. But by God's grace, next year, because of all of you, Medical Mondays family, and everyone else that we will contact, please, we need to donate to this cause so that girls can be taken. Traveling is an education. When you travel, you get educated. It's a lot that they get done when they bring these girls together physically. Even virtually, they achieve some things, but physically, it's phenomenal. So we're going to talk more about that before this is over. I have people who have raised their hands, and I have lots of comments in the platform. I have to keep quiet and let others speak. I'm really excited about this. And again, I want to thank the men who are on this platform. Thank you, because you're very much part of this. For seeing the topic and not running away. So thank you.
Yes.
Sister Tinade, kindly unmute and unmute your camera if you can. I think faces should be put to this. Kindly unmute and ask your question. Thank you. Okay. Please unmute the camera. Thank you. Okay. That is Attorney Tinu Akinshola that has said we were together on Saturday collecting feminine products. And guess what? Dr. Azumah was the one who said she's donating 500.
Yes. Thank you so much, Dr. Azumah. When Dr. O told me about your intending donation, I wrote it down as a promissory. And hearing you say a lot of what you said tonight. It just really broke my heart. And I'll tell you why. Let me start from where Dr. O ended. And Dr. O, please allow me. And people, everyone, good evening.
Go ahead.
Yeah, okay. Dr. Craig, it's good to see you again, sir.
Thank you, Dr. Tino.
Yes, sir. And all of you, my beautiful sisters and brothers.
Yes.
Okay, so I'm going to start from where Dr. O ended. And this is actually saying that appreciation, expressing her appreciation to all the men in the house. And I truly also say that why I said that is because it really takes a man, to be a woman champion, someone who encourages and who empowers, because we're saying that we want to empower women, but we need our men also to be in agreement with these empowerment programs and initiatives that we run all across globally. So thank you. And that being said, a man that I know, I met, young man actually in his 30s. He has just relocated to the United States. I believe it was 2 years before COVID. And I was telling him about what was on my heart, but I did team up with him, or I want to say initiated discussions with him, because he really broke my heart as someone who wants to, in fact, he started an initiative on pads, for young girls. Nigerian. He is a Nigerian. And if I say it, you can go Google it. He's really giving 2 awards before. Padman is his initiative. So we call him Padman, but I don't want to say his first name because for some reason we went on a tangent, and but he continues to do his initiative. Now, this thing that you have done, Dr. Azumah, is a very wonderful thing. And like Dr. O said, on Saturday, we had a drive up and all that. And there were so many responses and people, even from all over, through Dr. O too. There was someone who actually gave us in Naira and said, I want to donate, but I want to donate in Naira.
That's my Uncle Nini.
Oh.
He's in London actually right now, vacationing, and he said, "Can I donate in Naira?" I'm like, "Send me your Naira account."
And
that Naira account, and they have a Naira account because they are actually in Nigeria. I think you're in Togo also.
Mm-hmm. We have an initiative in Uganda and in Nigeria. Yes. So we have vocation programs for girls.
That's a man, Uncle Nini.
I know. But I'm saying that the person gave us 50,000 Naira. It's a lot to me, when you talk about Naira also. So thank you to him. Now, I was jotting down a lot of things, and I've talked about 2, the Padman initiative for girls, education for girls 12 and up in Nigeria. I've spoken about that.
Mm-hmm.
Then I will also touch upon where you mentioned myths, bursting myths and all that. I love that because every presentation I make too, especially on domestic violence, I love to say what is the myth and what is reality. Yes, now, it's a myth also when somebody look at a young girl or even a young woman, for example, like one of the aunties who traveled out recently and did not pack her pad, of course, maybe perhaps her skirt or clothes would be stained.
Yes.
Anyone looking from outside to her would say, what type of a dirty person that is. You're not dirty. And that is what we need to be sharing with young girls 10 and up. And I say that because I went to a girls only school, Auntie Girls High School in Obalende, Lagos. And during those monthly periods for all of us, almost all of us at one point or the other had our skirts or dress. When you are in Form 4, you start to wear skirt and blouse. But when you are in junior class, you were just wearing the dresses. So everybody, every one of us, once our clothes are stained, of course, you can't go into the school office. They don't have any supplies for you. Maybe the women have for themselves, but they don't have for you. They will even shout at you and say, just go out from here, you dirty thing, all those things. And us Africans. So, but girls, we have sweaters, and that's what we tie around our waist. Anytime you see an Auntie Ayo girls' high school student tying their sweater, that's her period. And it came to her on science, and so, and I'm saying that because the education part of your program is really unparalleled. And I say it's unparalleled, not because you're going out to educate them about what a period is and all that, which I said the Padma person that I know did, but the very poignant and the unparalleled aspect that I feel is the part that you are zooming in. Of course, being the scientist and the medical practitioner you are zooming in on the trauma, the effect going through monthly periods have on young women, even on women onto adulthood. So that is that part that I think that we need to even focus and engage more in. Of course, advocacy. And I thank you, for your promissory to She Rises International. Of course, we want to be a partner with you too, and it's a great initiative, menstrual equity. We need to love our menses. We need to teach our girls to love their menses and to talk, and we need to advocate, proactively. You're studying in DC. Please, let's do Maryland also so we can lobby. In fact, the products that we had, the initiative we had on Saturday, we were supposed to be doing high school or middle school, but I couldn't wrap my head around it. But our intern came up with, oh, Miss Tino, it's Juneteenth. Let's do this self-care thing for young girls. We did an Instagram show, but then this one on Saturday, it was so much, and it was a lot of people come out, dropping things. And I kind of just say, thank you. Yes, we need to advocate more, and we will be your partner by God's grace.
Yes.
Thank you.
Yes. Thank you. Thank you. Thank you. Partnering, very important. Thank you. Dr. Buka, kindly unmute. You have lots of questions, Dr. Ebere. Lots of thank yous. Great presentation. Dr. Kubuka, there you go.
Yeah. Thank you, Ebere. Nice seeing you again.
Yes, ma'am.
We were together yesterday from AMPA. Yes. Well, this is interesting because when I got my period, my mom wasn't at home, and I woke up with this blood stain. I remember it to this day. And my father said, wait till your mom comes home. She comes the next day. She was in Georgetown. And then when she comes, she doesn't say anything. She takes me down to her old aunt, who sits me down. All they say is that if you do anything with a boy, you will get pregnant. That was my education. So,
that was mine too.
And I didn't, and this was somebody she grew up with. I didn't know anything about period. And I was a smart kid at school. Anyway, I wanted to tell you that I don't know what happened in Sierra Leone. They just had elections. But if they win again, that president's wife has an initiative like giving napkins and different things to the schoolgirls. So she does have a program for men. I don't know what it entails, but it's all over the poster. So I don't know what's the result of the thing. And let me be honest with you, I hated the time when my period came, because in those days, I'm not ashamed, we used cloth napkins and you had to wash it at night, put it out. For a whole week, you were washing it. And then the next week, in my time, I did not, growing up, initially, we did not use sanitary pads. Oh, that's dirty. Look how it smells. So that's part of why I hated when that week came around, washing napkins at night so nobody could see you and putting it out at night. So that's one of the myths. But thank you, this is interesting. And I know people in Uganda, because we did medical missions, I'm sure they are so poor, I'm sure they welcome this program. I would love to take it to Guyana, but I have to find out the politics first. But I'll get in touch with you if I do. Thank you.
Thank you so much. Thank you for sharing. Oh, wow. You know, Auntie Tawa, I'll be right with you, but you know, you mentioned something about clothes, products, and cups. And I was going to ask about that because I'm not going to lie. I use sanitary towels. I never knew about towels. You wash towels. I always had the disposables. And I was blessed. Yes, 7 days of heavy periods, blood clots, but I never had pain. So it was just this nuisance. But you mentioned that, and Attorney Tinu put in the platform that on Saturday, we collected some reusable sanitary products. What are those? I've never seen or heard of them. Can you talk to us about the cups and the cloths?
Yes, I can. And I can also look through my slides, previous slides to show you sample. But most people are becoming like more environmentally conscious, right? Because disposable means it has to be disintegrated. And, like just people that are conscientious of the environment are pushing forward for us to use more reusable. Some people say it's very cost effective. For example, the cups you can put, it's like a little cup. I'll show you a picture. You just put it into your vagina, it collects the blood, you just pull it out, rinse it, and then reinsert it. Some people like it. It's not going to be comfortable for those that are heavy bleeders, right? Because you'll be changing often. But I know people that really, really like it. People that have converted to the menstrual cups, some of them have refused to go back to disposable products. We have the cloth material, the reusable pads. It's really cool. Again, some people are comfortable just washing it, like rinse it, put it in the washing machine, and then they reuse it. They even have like underwears, reusable sanitary underwears that some people also use and they like it. So again, it's all about giving options and having a multidisciplinary approach. Like Sao Tome, they do not want to hear about disposable. In Nigeria, we brought in disposable. Some people like Maureen, they're like, oh my goodness, oh no, we don't have enough water or soap. Now you're asking us to have this other additional element to our menses. No, it's going to traumatize us. It'll make us more period traumatized. We're not doing it. Actually, me and my team, we're self-sponsored, but we're working on a study to see if we can convert people from disposable to reusable. So we have identified a group of girls in Abuja, whereby we will provide them with reusable pads and see if there's going to be a shift in culture. And we're going to be comparing them with Sao Tome, which it's their normal. And also, we're also going to be comparing these three groups. So Sao Tome, Abuja, Nigeria, and also Uganda. Uganda is an interesting place. I haven't been there yet, but I know that they have water and soap. But something that we learned about culture by just interacting. What we've seen in Uganda is they do not know to wash their hands with soap. It's just not taught. So one of our goal of programming is to teach them how to wash their hands. Like in Nigeria, people might not wash their hands after using the restroom, not because it's not thought, but because they don't have access to water and soap each time. So it's really interesting, like through menstruation, we are learning about behaviors and we are learning to educate and help our society. I think the first time I heard they have water and soap, they don't wash their hand, it was like, wow, that's a simple initiative to pilot, and help people cut down the spread of diseases. So it's really interesting.
Fantastic. Thank you so much. That was why I said it, because I didn't want Medical Mondays family to walk away and think that you do just menses. It's a lot more.
Yeah.
Thank you. And Dr. Ajay just sent me, wow, you won't believe it, the cups, even cloth pads that are reusable. This is amazing. Thank you. New knowledge. Auntie Tower, kindly unmute and ask your question, ma'am. And welcome, ma'am.
Good evening, everyone.
Good evening.
Dr. Azumah, and thank you for the other time.
No problem.
Appreciate that.
Thank you.
I have a couple of questions. The first one is about this cup that Dr. O already said it, because I've never had a cup, I've never heard of reusable. It's just amazing. The reusable, do they have to wash it, or what do they do? How do they reuse it?
Yes, they have to wash it, but it's not difficult to rinse out. It's really cool. A lot of people, people that are very environmentally conscious use it. And for us, Love Your Menses, we tell people that we are not an extremist group. We're not political, because all political groups want to cut us. This one wants us to be part of their team. We're like, no, we're primarily educational. So the groups that are against are so pro-environment, God bless them, they even frown on us using disposable. But we have to tell them we're educators, so we listen to the people. Sao Tome is 100% no disposable products. We hear you. We will continue to give you reusable cloths. So we meet people at their point of need. And I'm going to pull up a product slide shortly so that I can share with you guys what it looks like. So bear with me, keep on conversing or asking questions while I look for the slides so that we can educate everyone. Thank you.
Thank you
And
for that.
Dr. O, you have another question?
Yes, I have many.
Dr. O, what I used was the napkins that we used to give to babies.
Yes.
The cloth napkins.
Yes.
That's what I use. And I didn't have washing machine. It was all by hand.
Oh, wow.
Oh, my dear, but
Wow.
I survived.
Yes.
And I had 4 brothers. So you imagine how I had to hide it to wash it at night and put it out at night. So
wow.
I survived.
That's why you are who you are today.
Exactly.
Our very own Dr. Booker. That is why, all of everything, kind of gave us the strength, how do you call it? Made us more durable and got us where we are. I praise God for our parents, because they taught us. They taught us. And I pray that we have done the same for our children. I'm waiting for grandchildren to spoil rotten, because those ones are not my responsibility to train, right?
Yeah, I think you're looking
My
for
other
resilience
question,
and resourced.
I still have questions.
I said they're looking for resilience and resourceful.
Yes, thank you, ma'am. That is it. They taught us to be resilient and resourceful. Thank you, ma'am. Those are the words I was looking for. Thank you.
I got you.
My other question to Dr. Azumah is the young girls now, they start menses very early as 6 years old.
Yes. Yes. Yes.
So how I can't comprehend it, because that means that they go to menopause earlier.
Yes.
Or what?
Yes. Okay, so what your question is to touch on the age for
Yes.
Okay.
Very.
Yeah, so on average, like you said, on average, people start their period, their menses at about 8 years old, 9 years old, but we see that some youth will start it at 6. Those people that started that early needs to go and be evaluated, that they don't have something like precocious puberty. So they still have to be evaluated, right? So it's not normal. to start it at 6. So you have to see your pediatrician or your endocrinologist to work it out. But yes, on average, it's at 8 compared to before. And we think it's environmentally induced more so because of the food we eat, right? We eat a lot of processed food. And then we also use a lot of products, like our hair products has like endocrine disrupting hormones, right? We know that for sure, especially Black girls, you know, the desire to look a certain way is affecting our hormones. So we see that, and that's why we talk about safe products and eating healthier, and also the wellness part of menstruation. So when we go and teach understanding our menstrual flow, like Dr. O says, we talk about mental health. We also talk about right eating. We also talk about, we just basically use it as a teaching tool to empower our young Black girls. And it's really cool for them to see Africans coming to America to give back to our youth.
Please,
So
before you go on, man, I want you to say something a little bit more about that food, and the hair. You said the hair, if they want to look a certain way. Are you talking about the calming products?
Correct. Yes.
Stuff like that. Because even 8, 9 was too early. In our time, you know, you get into your teenage years before you start menses.
Yeah, I mean, unfortunately, the masses, you see mothers palming their kids' hair early, right? Because it's just easier. You know, if our mothers are not empowered themselves, it's going to be hard for them to empower their children. So we see that trend, mothers that are not comfortable in their own hair. I do have extension, but I'm comfortable with my hair. But yeah, I just have to do that disclaimer.
Everywhere.
Yeah, so you're not comfortable, you can't teach your child better. So we see kids young, even using bleaching creams and all of those things. And I can predict that child might enter early menarche.
Thank you. Auntie Tawa, your next question, man.
Yeah, my next question is about, are you thinking of incorporating men into your program? Because these girls are going to get married. If the men doesn't understand it, it's like, what is this? So are you planning to bring them into this and not just girls?
Yes, and thank you, Tawa. There's someone, William Craig talks about phthalates and all of this. It's just everywhere. Like these endocrine disrupting products, even hair cream has it. You have to like read everything. Even shampoo has it. So you just have to, again, we're working and people are working hard to lobby against phthalates or any of those products because we're seeing that it's affecting our menses. Back to you for men. Yes, we've worked with men. We have Men for Menstruation program. We piloted that in Massachusetts. It was very successful. And I'm serious, like the PAD man that Attorney Tinua Ade talked about, when men join the movement, I think is very powerful. That's why, again, we do not associate ourselves with groups that are against men involvement, because we don't, a lot of things people want to make it political, but it shouldn't be, especially if the primary goal is to help the youth. We focus on that more than politics. So yes, we need men, and that's why we have men in our program. For example, James from Kenya, James brings in different dynamic that me and my team would not have thought of if he wasn't a part of us, because men know how to speak the language that meets other men. Those of us that don't know, you know, for example, men don't say, please, 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 I beg, all this stuff. Like when I'm doing it, they're like, no, stop. You got to stand strong. Not that women are not strong, but it's just really cool to have diversity in thoughts. So yes, we need men, we go to men, and we appreciate men.
And do you plan to take this to school so it can be taught in school? Because I was taught.
They are in schools already.
We're in schools already. We're in like 3-4 schools already. Yeah. We do.
Because I was taught all this in school, in primary school.
Oh, wow.
Yes.
They missed my primary school and even secondary school.
I mean, in Florida State, the governor has banned the education of menstruation. So it's a political topic for some people, even though, people label us as whatever, as very liberal, but we just teach menstruation, and we tell them that that's taught in medical school. I guess, except people think medical school is liberal.
Wow.
Thank you, Dr. Azumah.
No problem. Thank you. Excellent questions.
Yes. Thank you, ma'am. Dr. Oduyebo said, thanks for all the encompassing introduction. If you have some time, can you discuss body odor pathology, as there are people who are capable of noticing unusual odors even from a mile away? Thank you. I think it may be alluding to, the odor during menses when it's not quite sanitary. I don't know.
Yeah. I mean, that's a very good question.
And that's a man. That's a man. So it's, he must have been smelling this, that woman on a period.
Yes. Thank you for that's Adrenaki. Thank you for bringing up that topic. Again, remember 1.8 billion women menstruate. So having smell through menstruation is not common. It's actually a taboo or a myth, because that's not true, right? You don't go to stores and be like, that smells, right? But a lot of women that you see on the street do have on their period. So what we do is we teach young girls how to keep themselves clean, because not all young girls are taught hygiene. I remember as a gynecologist, a young girl, 19 years old, Caucasian lady, comes to me and say, "Doctor, I'm having vaginal odor." Instead of me talking about your diet and whatnot, the first thing I was like, how often do you shower? And to be surprised, she wasn't taught to shower every day. She does not shower every day. She showers maybe every 2 to 3 days. She didn't know that. And I said, okay, let's say you don't shower. Do you wipe down there? No. So what we do in school is to teach young girls how to keep themselves clean, like how to, clean their private parts and just wash and, put the deodorant. I think that's first step. And then if they are still having all those negative smell, then we'll teach them how to, use, eat foods that does not cause you to smell, like onions does, garlic. And then we go from there. And then the last one will be to evaluate them for like maybe something pathologic. I don't know if that answers your question.
Yes, that does. My sister Chanel said, you spoke of the disparities of menstrual periods and supplies.
Mm-hmm.
What are the insurance companies doing, such as Medicaid? Are they paying for these products upon doctor's prescription? Is it covered? If not, how can we champion this? How can we champion for this to get insurance companies to pay? That's an excellent question.
I know. I've never thought about it. And
I never thought about it.
They won't be happy. They think they're paying a lot more now. But you're absolutely right. Why can't insurance pay for our youths to pick up pads, right, from the drugstore? I mean, I think we've not had insurance company come into that conversation. That's something to look into. So thank you. I'm not sure where they stand, but it will be a good conversation to at least speak with the mayor of Boston to see what her take is.
Well, in Maryland, I've not seen an insurance company pay for feminine products, except for the elderly who needs, the diapers. They pay for those. I know Medicaid, Medicare, even commercial insurances pay for those. But for, pads, I haven't seen. I need to look at it again, though.
Yeah.
I'll revert back to you.
Yeah.
I'll revert back to you. So
I think the group that is against abortion, what is that they call this, is probably it's more relevant in their category. But insurance company, what's the name called?
Pro-life? Pro-life?
Not pro-life. They have another name.
Pro-choice? Pro-choice?
No, pro-choice.
No, they have another.
They just want abortion.
They are in so many.
Yeah, you're right.
They're in a lot of neighborhoods. And the government is sponsoring them. or they're getting government funding. I forgot their name.
Really?
Yeah. So
please,
I
man,
mean,
when you remember, can you share that?
yeah. I'm just saying, if
Because
we're going to advocate, that would be one area is right in their alley for them to do that.
Yeah. Okay. Yeah, that's
fantastic.
smart. That's smart. Thank you.
Thank you, ma.
Thank you, ma.
Haman from London, and he's a guy, said this is very topical as a subject in England. In England, at present, with government being lobbied and setting up studies through the NHS to engage with employers and other agencies with this issue, that apart from affecting women, it relates to GDP and general social well-being. Many forward-thinking institutions and employers are incorporating work patterns, help, and support that is available. This is a situation that disproportionately affects the Black community, which is why Dr. Azumah and our group are targeting the Black youths and brown ones. Also, he said, the issue of menstrual products is being addressed, but being outstripped by demand in schools and colleges. Many food banks also provide these products.
Yes.
There has been a substantial increase in absences from schools since the initial phases of the pandemic, but still prevalent today. Great work. Leave contact details so I can send info here. Also, the additional tax these products has been substantially reduced or not incorporated in the full price. Ending period poverty is very much the aim expressed in the UK. That's good to know.
That's good to know. Yes, ma'am.
Yeah. And Dr. David Ajibade wants you. He said, fantastic presentation. We need to get you on their award-winning TV show, voted #1 health TV show in Africa. So
Wow.
I'm going to connect you because this is an important topic and you are very hot, very sorted for.
Yes, ma. Thank you, ma. Thank you for the connection. Thank you for advocating for our youth. Thank you. Thank
You're welcome.
you.
Thank God. Thank
Yes,
God.
ma.
So in the chat box, and this is to everyone, you will see, and I'll keep copying and pasting Dr. Azumah's email address. Please let us donate to that trip for next year in Kenya, and also for what they do. What they do is huge. This is huge. This is for our generations. This is for our children. It reminds me of NAPAC, the Nigerian American Public Affairs Committee. That is political, positioning our own, our children, our next generation in places of power so that they can be a voice for us.
Yes.
It's the same thing. Please, let's support this. Let's champion this. Dr. Craig said, at a greater level, as the organization interacted with the AMA to impact those physicians and clinicians who push the negativity of menstruation by supporting pharmacological items which are in line with the negative.
Good point.
Good point.
Good point. Good point. That's another, that's another avenue that we will look into. Again, it's, we're trying to publish more scholarly articles so that this could be addressed. Again, it's just a human capacity. Like I said, it's just a group of us that have full-time jobs that come to do this work. So we don't have the human capacity, but God will make a way by God's grace.
Amen. Amen. And Haman is thanking all of you. Dr. Izugu, kindly unmute. Good. You are muted. You can ask your question.
Sure. Thank you so much. I really want to commend your thinking outside the box to really have such a program going. It's not only a social health issue, but you tackled it without, just from your profession that the need is there and you just keep pushing with it and helping people. For us, I'm a man, but we also do clinical things. And if there's a way we can, bring that education to we have healthcare facilities to bring that kind of program to those areas, as part of outreach and teaching and education, and using some of our healthcare providers in our facilities, we'll be glad to do that because it's a very needed thing, and we appreciate what you do.
Thank you so much. And you know what? Let me verbalize that a little bit further.
Yes, ma'am.
Dr. Ezugu started amazing, state-of-the-art cardiac centers in Nigeria, in Enugu first, and I pushed him to start the one in Lagos.
Wow.
So Lagos has opened, it has been approved, and it now incorporated family practice so that you have the full extent. Guess what? Also partnered with the National Insurance, Health Insurance.
Yes.
So that people pay, your people, we need to get them all 25,000 naira a year insurance, and they get to see the doctor. That's on discount because of the partnership. Now, that's what he's talking about. In Nigeria, that's Enugu and Lagos. You already have Abuja. So you have those two places now that this can spread to, where young ones can be positively impacted. That's what he's saying. Correct?
Exactly.
Did I articulate that well?
Yeah, you did it very well. And that's why you are in that chair.
Yes.
Thank God, yes.
So I'm on the board, so I know what is going on there.
Wow.
And it'll be fantastic to incorporate that, to partner. That's another partnership apart from She Rises.
Wow, thank you, thank you, Dr. Ezugu. And we were thinking of launching Love Your Menses and Your Health. And one thing we wanted to carry across is CPR education wherever we do a menstrual message. Because if the youth know their menses and can save lives, we would make a difference in communities. So maybe we can partner together and launch that with you.
Definitely.
Wow. Nice. He's a cardiologist, one of our best.
We thank God. Yes.
So fantastic. Attorney Tinu said here that you're right. I think she was talking to, where's my dog here? Dr. Booker, she's there. I think she was talking to Dr. Booker that she's right, that about two ladies from the island pulled her aside on Saturday when we were at the, drive, that they didn't use sanitary products growing up. So now we know they existed. People like me were so clueless, God help us. So Haman said again that, Dr. Azumah, have you any hindrances in the program with any members of the wider community, that is LGBTQ, etc., or how have you, or you have to work imaginatively to get the message across, maybe is what he's saying, help and support to those who are happy to receive? That's a great question.
You can't shame the shameless, meaning that we don't care about what your political agenda is. We care more about the message. We've been approached by LGBT groups to focus more on equity, because transgendered youths don't fit into the box of girls or women, and we respect that. So when we teach them, we are sensitive to that, but we still will not change our core messages, and we have them understand where we are coming from. We understand their movement, we understand their goal, but we also are international. So we want to focus on the youth education. So we let them know the bigger picture, and we let them know that we do not discriminate against anyone, because you can't as a nonprofit, and you shouldn't at all. So they understand and they work with us, and they love what we do, but we make sure we let people. Planned Parenthood has, tried to sponsor and help us out, and we appreciate it. And we let them know that we're not a political group. The group that hasn't reached out to us are the Christian organization. It's so interesting because they think we're extremely liberal. And I'm like, they don't realize that I'm a prayer warrior. So it's really interesting, but it's okay. We continue to push our education to our youth, because our youth, especially our Black and brown youths, need to be empowered.
Thank you. Amen to that. Thank you. My sister, Dogonyaro from California said, did you say as early as 6 years old? Yes, sis. Children 6-year-old now are starting to menstruate. It is true. Madam CEO, Madam Lara from California. Dr. Ebere, your camera has been out. Show your face.
Okay, I'll show my face. I'm still at work. I'll show my face. Yes.
Go ahead, ma. Go ahead,
No,
ma.
the name of the organization I was trying to remember is Planned Parenthood.
Yes.
Oh.
Okay. Yeah. Planned Parenthood. Yeah.
They should be able to. Yeah, they should be able to, because part of parenting, when you start to menstruate, from the stories that everybody told, that means you're ready to have a baby. So I'm worried about a 6-year-old, 8-year-old being in that cycle. But Planned Parenthood, this is within their alley to provide, even if it's supplemented, or discounted or some kind of ticket, but they should be able to support this initiative.
Sure. Yes.
Thank you. Thank you, ma'am.
Yes, ma'am.
So Attorney Tinu said we have to engage our regulators and state delegates for school education. Yes. And thank God, Dr. Azumah and team have already penetrated the schools, 3, that is huge. That's where it starts, and it's going to continue to grow. And with your partnership, we'll all be working together to make sure that we penetrate more schools.
Yes,
when my children, since when they were in high school, I go give sex education, cessation education, and then I took it down to middle school. When I found out that this thing starts even in middle school, they're telling me it's elementary school. I'm like, oh my gosh, I'm done. So we have to keep at it. I don't mean I'm done, not educating anymore. I mean, we have to take it even further down and just, keep going. So when 6-year-olds are menstruating, that too. Dr. Craig mentioned that the most prevalent endocrine disruptor in use is the phthalates. And Dr. Azumah addressed that already. I think I'm mentioning it again because in case somebody missed it, we need to know that. We need to remember that. We talk about diet, what we put in our mouths all the time, what we put in our bodies also. What we put in our hair. Natural hair is great. Let's rock it.
Yes.
Madam CEO, go ahead, ma. You can unmute.
Yes. Thank you. Sorry, I'm driving. I couldn't take off my camera. But the 6-year-old issue, it continues to bother me as it does probably Ms. Dongoyaro. And one of the things that jumps to my mind is the unfortunate accusation, because I'm unaware if I 6, I'm unaware that this is possible, even from the biological system. But can you imagine how many men have been accused of molesting a 6-year-old like that who is menstruating without understanding that this is an environmentally triggered, cycle. So it has to also be addressed for awareness, not just the 6-year-old, that it could happen to any female because of certain things that you're talking about, at least from that angle. Because, in Africa, for example, that we come from, people get accused of things that they know nothing of because it's not logical. We've never encountered it. And lack of awareness, unfortunately, sometimes creates some unhealthy assumptions.
Okay, very good. Very good point. So that's where our understanding my menstrual flow comes in. We teach the youth, like regardless of the age, how to say no. We even show them like how to consent to things and how to, I even have a journal that I'm publishing, a period journal that encourages anyone that starts perioding, regardless of their age, to find a period mentor.
It necessitates.
Yeah, so we say get a period mentor, and then the mentor will guide you through it. We also ask the youth to have a code word, right? Because some cultures, as you've alluded to, once you start menstruating, you're a girl, like you're a woman now, but they really are not, right? It's not the physiological changes that makes you a woman. It's more than that. So we even teach the girls how to have code words, right? Because sometimes now you have nice breasts, you know, his body is standing, your butt is rounder. Some people that are not trained to respect children will come for you. And if you feel uncomfortable, we show them ways of like calling their friends if they have a cell phone and just using a code word, like so that the friend can know that they're not comfortable. So we train them. That's the only thing we can do apart from them getting medical care to see the reason why they're having precocious puberty. Again, it's not normal for 6-year-olds to have their menses that early. It's not normal. So we don't want anyone to leave here thinking it's normal. It's not normal.
Yeah, I know. But what I'm trying to suggest, in addition to the great work you're doing, is the clarification that when that situation is happening, it's not necessarily a presence of an abuse. Can you imagine how many women have accused their husband of tampering with the kid because not knowing that a 6-year-old, something like that could happen?
Okay. Like thinking that it's trauma, that the bleeding is from trauma versus physiologic. Okay, that's
the bleeding is from sexual intercourse.
Trauma,
rape.
yeah. Mm-hmm. Yeah, trauma. Mm-hmm. Okay, I see your point. I see your point. But again, if a mother jumps into accusing her partner, her husband, there's a bigger problem, right? Because a girl that's menstruating will appear different from a girl that is raped. So maybe we need to educate parents the difference. So thank you for that. We would bring our team together and we'll mastermind a way of educating people in case they have a child with precocious puberty. But thank you. Good point. I've never thought of it like that. Thank you.
See, we know the difference.
Yeah.
Other people will not know the difference.
That's a good point.
So it's a great point.
Very good
I thought of it too.
Me too.
Thank you so much, Madam CEO.
Thank you.
So,
excellent.
Haman said it is important to have men involved as they will know some of the barriers of dealing with their peers and getting change within institutions, as many men, rightly or wrongly, hold the power at various levels, which is true. Also, vice versa, women will take note and use accordingly. And there have been many thank yous, appreciation. Sister Daisy from South Carolina, is very thankful for this informative learning opportunity and discussion. Okay, so Dr. Ajay said this topic is a gigantic educational project, especially when government officials and institutions are initiating the process for equity, education. From the government to the newest young lady who is experiencing this for the first time in her life. All we all need is education. It's a big step. For some, if a government takes the bold step in distributing the ladies' monthly sanitary products, others see it as a pulley to win elections via blood or foul means, which is, I must say, this organization is a great vehicle to enlighten and encourage people of the very topic we are discussing here on this platform. It's a great opportunity for us to spread the awareness that it's not a taboo or evil to have the monthly cycle. I'm employing everyone to go to the YouTube channel and share the link with all family members. Don't forget to like and subscribe to the channel. Dr. Azumah, good job. Let's know how some of us can help to reach out to the African government systems. There you go.
Yes.
There you go. I'm posting our email. I'm posting it again. Please reach out to Dr. Azumah and let her know where you can assist in influencing government, in influencing communities, so you can bring them in and have them be able to do what they do best, to enlighten our youth. Please share our YouTube link. Okay, the YouTube link is there for Medical Mondays with Dr. O. Haman said he will forward this session today to Caribbean and African Health Network, CAHN, and Dr. Azumah's email, so that you can feature in one of the regular health shows here via Zoom in England. So you're going to be in England, you're doing the TV show in Africa. I'm accepting all of this for you, okay?
Thank you, Ma. Thank you, Ma. Thank you, Ma.
I'm saying yes, yes.
Thank you, Ma. Thank you, Ma.
So it said it will be interesting to see if any funding initiatives exist in the UK or European Union for joint studies, etc., as the democratics and greater to work with your work in the USA. This could possibly come from corporate social responsibility departments of companies who make these products. Dare I say it is a win-win? Yes, even if it's the products that these companies can donate, they're very useful. They're sourcing for products all the time. If it's financial, they're very useful. They're sourcing for funding. You can't do these things without having the funding. And is thanking you for answering his questions. Dr. Craig said, thank you, Dr. Azumah. Well, he said, he's never too old to learn. It is certain that what has been discussed as a basis in poor nutrition and diet, it necessitates, in addition to your core message, the understanding and importance of nutrition. Right on point, right on point. Eating right, avoiding the processed foods is very important.
Yes.
Wow. Thank you so much. Which question did I be? I think I had all my questions somehow, some way. I snuck them in.
Yes, ma. Yes, ma.
Thank you so very much. This has been amazing. Thanks for the education. Thanks for all you do in the community, to our youths and also to adults, to everyone. Your selflessness, only God can reward you.
Amen.
We appreciate you so much. Thank you. So can you give us your parting words, something to take home that we will remember? And I'm asking again, Medical Mondays with Dr. O community, kindly reach out to Dr. Azumah.
Yes, our mantra is flowing through life unapologetically. Everybody on earth has a message. I do believe when the Lord says, go out and populate the earth, or he basically did not just mean biologically, but creatively. And there's nothing that is too small. Like I said, menstruation is a small chapter in our study in gynecology, but it's one of the most important. So starting this has really, really made me a better doctor, a better person. And there's so many places it can go. In Kenya, we piloted it in an orphanage, and just to see the change in the orphan's face, just learning about menstruation, just meeting people from the United States, I believe we have reawakened a geniusness in somebody. We never know who the next genius is and where they are. So we will continue to use Love Your Menses to find the Black geniuses. Thank you.
Thank you. Thank you so much. May the Lord continue to bless and enrich you and increase this program beyond your wildest dreams. Amen. We will get more partnerships by the grace of God and just keep, growing further and further. And till we meet again next week, I ask that, we all stay safe and stay blessed. And happy 4th of July coming. Can you believe it's July already?
Yes.
Dr. O, I have a question.
Yes, ma'am.
Sorry about that. I know you're about to close.
Yes, ma'am.
Since, the technology or whatever it is, options are being discussed tonight. Since people are able to collect their menstrual blood in a cup, can this blood now be recycled? Because can these women who can do this automatically become blood donors?
No.
No.
Wow, that's
No.
that's a very good
It's an
idea.
excellent question.
Yes, it's a very good idea, and you're thinking ahead of our time. I don't know how many people will accept blood donation if it's gotten from the uterus like that way. I don't know, but I have to tell you that there's a study on endometriosis whereby they use the blood from the cup to analyze to see if we can predict right now the diagnosis of endometriosis is surgical, but we're trying to see if we can develop markers that we will be able to identify and say, okay, this person has endometriosis, and identify them early so that we can start treatment early to prevent the sequela of like chronic endometriosis. So yes, people are using the blood from the cup for research, but I don't think we've gotten there yet, whereby we can use that blood as a blood donation. But I won't be surprised in 20 years if that's an option.
Just a thought. Thank you.
Yeah.
Oh my gosh, that is so forward going. It's so ingenious.
Wow.
Oh my gosh.
Especially for heavy bleeders.
For the heavy bleeders,
Yeah.
you know how much blood is wasted?
Yes.
Yeah.
Somebody like me, oh my gosh, they could have collected so much blood.
Or put it back into them instead of giving them blood, foreign blood for blood transfusion. So I mean, you might be able to get NIH grant for that.
You're right. So you need to start thinking of that. It's in your forte.
Yeah.
Territory.
Yeah.
So Dr. O, are we going to have a meeting next week?
No,
July 4th?
No, I think we should take a break and enjoy the 4th of July. What do you all say?
But you just said until we meet next week. That's why I'm asking you.
You're right. Okay.
That will be on the
Does anyone think we
9th
should
of
meet
July.
next week?
We should go and enjoy ourselves.
No, we're going to eat barbecue.
It's a patriotic day, not barbecue. You need to go and remember.
Civil War and the fight for independence. Mm-hmm.
Yes.
Oh, Dr. Damien Dublin from Dominica is saying hello. He says it's from a small island in the Caribbean, enjoying the sessions. Dr. Damien, I've not seen you in a while. You don't chat in the chat box. It's so nice to see you.
Yeah, I missed a few sessions. I've followed a few. Not every time I'm able to comment because like so many people try to connect, but I always try to follow as much as I can. I need to really commend you for initiating this. It's tremendous program. I mean, the level of knowledge gained from other people's experience. I mean, maybe more than you imagine, but it's really useful, the sharing of knowledge, and that's how we as physicians supposed to do. I'm not a physician but a dentist, but I enjoy the sessions still anyway. So I'm from Little Island, Dominica, H Island, we call it. Descendants of enslaved Africans. We also have
network.
Indigenous people.
Network is networking.
Yes, network, it's fading.
So we are fortunate to be enjoying a mixed culture. So we're giving you flowers, Dr. right now.
Thank you so much, Dr. Dublin. It's so nice to see you again. And you always contribute, you always ask excellent questions and give great contributors. We appreciate you. Nice seeing you.
Yes.
Thank you. Thank you all. So the next Medical Mondays,